Thank you for watching Studio 7 from the Permian Basin Chevy dealers.
Welcome back. It might be described as the best kept secret in dentistry. Why? Because when you have one, no one knows. And it plays a very important role in both your dental health and beauty. In this week's Ageless Beauty, Dr. Robin Rutherford from the Art of Dentistry is here. Dr. Rutherford, thanks for being here. We've touched on this idea of a dental implant before, but today we're really going to break it down and find out how this can benefit you. So let's start at the very basic. What is a dental implant?
What is an implant? An implant is basically a replacement tooth.
Okay.
So if you are missing a tooth, and I have a little model here, well, an implant is a titanium metal post that I would put into the gums and the bone like this. So it looks like there's a root there. Okay. And then if that's the root, well, then you put the crown on the top, just like you would put a crown on a tooth. And so together, an implant plus the crown equals a tooth.
Okay. So we're going to start with, you have some x-rays that you want to kind of teach us a little bit about this. So tell me what we're seeing right here.
Okay. This is a panoramic x-ray, it's called, of a patient of mine. This is just a picture showing the implant in place to replace that back tooth on the upper left.
Okay.
Now the next x-ray shows with the crown on it.
Okay.
And so when you have the crown then put on the implant, you have your tooth replaced.
But you say there's also something to see on this far side. The tooth looks kind of catty-cornered, lopsided. That's a problem.
Yeah, this is an important thing. It's dropping down out of line, and the tooth behind is collapsing. Everything collapses into the hole. So if you do have to lose a tooth, I really recommend that you replace it, like with an implant.
Okay.
And not after 10 years or something, someday when I get around to it, but it should be done there at that time.
Okay, so the second scenario that you want to tell us about, a lot of people have this. This is a reality for them and not always a pleasant one, right?
Right. If you have missing teeth, one way to replace a missing tooth or teeth would be a removable partial denture. And we have a picture on the screen here. Okay. And if you have a partial, you know what I'm talking about. And it holds on to your other teeth by little clips, which you can see on the upper part there, where it clips onto the other teeth that are there. Now, I will promise you that no one out there loves their partial. Yeah. If you have a partial and you've had it maybe for years, get implants.
Okay, in the third scenario, this is an aha moment for me. I did not even know this was possible.
One of the big problems if you have dentures, people who have upper and lower dentures where they've lost all their teeth will tell you that dentures are floppy, dentures are loose. Okay, here's the big benefit of implants. If you place a couple of implants, the implants are under the surface, and instead of putting a crown on the top so it looks like a tooth, you put the little snap type of attachment, and we make you a new denture or dentures, top and bottom, and it has the little snaps inside, and so it makes a little click on, and now
the security you must feel.
It has something for the dentures to hold on to. You know, to do the best for our patients like we're ethically bound to do, it would be unethical not to recommend and to mention implants. Okay, if you look at this x-ray, this is a lady that came to me literally last week, an older lady who's had dentures for a long time. And she and her husband were there, and they were saying that she can't eat with the dentures that she has because they have nothing to grip onto. Look at this x-ray, look on the left side and the right side, and you'll see how thick your mandible, your jaw, is supposed to be.
Okay.
She's had these dentures for a long time, and look how thin her jaw is at this point. The whole bottom front section is literally less thick than my little finger. It's like a pencil. Yeah. Now, she can't have implants because she doesn't have enough bone even to put an implant in. It would break her jaw to even try.
She waited too long.
And so she waited too long. Yeah. So don't wait too long is the moral of that story.
Dr. Rutherford, thank you. This is kind of an aha moment for me. I didn't know some of this stuff was possible, and it's a game changer.
Yeah, we can do great things nowadays.
Thank you for being here today.